Welcome to my channel. In this video we are going to learn about parts of long bone. A typical long bone ossifies in three parts. Two ends from secondary centers and the intervening shaft from a primary center. Two ends from secondary center, intervening shaft from primary center. Before ossification is complete, following parts of the bone can be defined. Epiphysis, epiphyseal plate or epiphyseal cartilage, metaphysis and diaphysis. Epiphysis. These are ends of long bones that ossify from secondary center. Ends of long bones that ossify from secondary center. Types. There are four types of epiphysis. Pressure epiphysis, traction epiphysis, atavistic epiphysis, aberrant epiphysis. Pressure epiphysis. It is covered by an articular cartilage. Pressure epiphysis covered by an articular cartilage. Takes part in transmission of body weight. Takes part in transmission of body weight. Examples: head of femur, head of humerus, lower end of radius. Head of femur, head of humerus, lower end of radius. Traction epiphysis. Traction epiphysis. It is produced by pull of muscles or muscle. Examples: trochanters of femur, tubercles of humerus. Greater trochanter, lesser trochanter of femur, greater tubercle and lesser tubercle of humerus. They are always non-articular. They are always non-articular. Always ossifies later than pressure epiphysis. They always ossify later than pressure epiphysis. Provides attachment to muscles or muscle. They provide attachment to muscles or muscle. They are produced by pull of the muscles or muscle. They are always non-articular. Always ossify later than pressure epiphysis. They provide attachment to muscle or muscles. Examples: trochanters of femur, tubercles of humerus. Atavistic epiphysis. It is independent bone in lower mammals, but in man it gets fused with nearest bone to receive nutrition from host bone. It is independent bone in lower mammals. Independent bone in lower mammals, but in man it gets fused with nearest bone. Why it gets fused? It gets fused to receive nutrition from the host bone. In man, it gets fused with nearest bone to receive nutrition from host bone. It grows like a parasite. Examples: coracoid process of scapula, posterior tubercle of talus. Coracoid process of scapula, posterior tubercle of talus. Aberrant epiphysis. It is not present always. It is present only in some individuals. Epiphysis appears at unusual end of short long bones. Examples of short long bones are metacarpals and metatarsals. Examples for aberrant epiphysis: epiphysis at the head of first metacarpal and base of other metacarpals. Normally, metacarpals have only one epiphysis, that is, at the base of first metacarpal. Normally, at the base of first metacarpal, epiphysis is present, and for other metacarpals, epiphysis is present at heads. First metatarsal or metacarpals should have epiphysis at base, but here epiphysis is present at the head of the first metatarsal. Hence, it is present at the unusual end, that is aberrant epiphysis. Epiphyseal cartilage. It separates epiphysis from metaphysis. Proliferation of cells in the epiphyseal cartilage is responsible for growth in length of a long bone. Proliferation of cells in the epiphyseal cartilage is responsible for growth in length of a long bone. After epiphyseal fusion, bone can no longer grow in length. After epiphyseal fusion, bone can no longer grow in length. It is nourished by epiphyseal and metaphyseal arteries. The fusion of epiphysis occurs 2 or 3 years earlier in females than in the males. Thus, females are shorter than males. Epiphyseal cartilage separates epiphysis from metaphysis. Proliferation of cells within the epiphyseal cartilage is responsible for growth in the length of a long bone. After epiphyseal fusion, bone can no longer grow in length. It is supplied by epiphyseal and metaphyseal arteries. Now let's see metaphysis. These are ends of diaphysis facing towards epiphyseal cartilage. Ends of diaphysis facing towards epiphyseal cartilage. Metaphysis is most actively growing area of the bone. It is most actively growing area of the bone. Before fusion of epiphysis, metaphysis is profusely supplied by nutrient artery, periosteal artery, periosteal arteries, and juxtaepiphyseal arteries. These are end arteries and they form hairpin like capillary loops. They form hairpin like capillary loops. Microorganisms circulating in the blood may settle in these loops. Microorganisms which are circulating in the blood, they may settle in these loops. Thus, metaphysis is common site of osteomyelitis in children. After epiphyseal fusion, communication is established between epiphyseal and metaphyseal arteries. As a result, metaphysis no more contains end arteries. Thus, osteomyelitis is rare in adults. After epiphyseal fusion, communication establishes between epiphyseal and metaphyseal arteries. Thus, metaphysis no longer contains end arteries. Thus, osteomyelitis is rare in adults. Diaphysis. It is elongated part of the bone between the metaphysis. It develops from primary ossification center. Diaphysis develops from primary ossification center. It is elongated part of the bone between two metaphyses. Let us now revise parts of long bone. Four parts: epiphysis, epiphyseal cartilage, metaphysis, diaphysis. Epiphysis. These are ends of long bones that ossify in secondary centers. Types of epiphysis: four types: pressure epiphysis, traction epiphysis, atavistic epiphysis, aberrant epiphysis. Pressure epiphysis, covered by articular cartilage, takes part in transmission of body weight. Example: heads of femur and humerus, lower end of radius. Traction epiphysis, traction. It is produced by pull of muscle. It provides attachment to muscles or muscle. It is non-articular. It always ossifies later than pressure epiphysis. Examples: trochanterus of femur and tubercles of humerus. Atavistic epiphysis. It is an independent bone in lower mammals. In man, it gets fused with nearest bone to receive nutrition from the host bone. Example: coracoid process of the scapula, posterior tubercle of talus. Aberrant epiphysis. These are not present always. They are present only in some individuals. Epiphysis at the unusual ends of short long bones, that is metacarpals and metatarsals. Epiphyseal cartilage. It separates epiphysis from the metaphysis. Proliferation of cells in the epiphyseal cartilage is responsible for growth in length of a long bone. After the epiphyseal fusion, bone can no longer grow. The epiphyseal fusion occurs 2 to 3 years earlier in females than in males. Hence, females are shorter than males. Metaphysis. These are ends of diaphysis that are facing towards epiphyseal cartilage. Metaphysis before epiphyseal fusion, profusely supplied by nutrient artery. Metaphysis is most actively growing zone of the bone. Before epiphyseal fusion, it is profusely supplied by nutrient artery, periosteal arteries, juxtaepiphyseal arteries. These are end arteries and they form hairpin like capillary loops. Microorganisms circulating in the blood may settle in these loops. Thus, metaphysis common site of osteomyelitis in the children. After epiphyseal fusion, communication establishes between epiphyseal arteries and metaphyseal arteries. Hence, metaphysis no longer contains end arteries. Thus, osteomyelitis is rare in adults. Diaphysis. It is elongated part of the bone between two metaphyses. It develops from primary ossification center.